Hey everybody, Dr. James Fedich here, Clinic Director at Village Family Clinic. Here to do some more frequently asked questions, talk about some problems that you might be suffering from. So we're here to talk about disc pain today. So there's 26 bones or vertebrae in the human spine, and the disc is a little shock absorber in between it. I tell patients the easiest way to think about it is like a jelly donut. There's rings holding it all together and some soft squishy stuff in the middle. And the reason is it's kind of your little shock absorber as they're bouncing around. So it does that. It also helps separate the vertebrae so the nerves can come out. So there can be disc bulges, disc herniations. We won't get into all the different disc problems, but what can happen is some of that disc can either bulge or herniate out, and it can put some pressure on the nerves. Discs are an interesting part of the human body. It's the only part of the human body with no nerve supply, no blood supply. So if you injure the disc, it won't really heal on its own because the blood doesn't get there. So I kind of tell patients, if you cut your finger, it bleeds and it heals. The disc doesn't bleed like that, so it won't heal easily on its own. It also doesn't have nerve fiber, so people think the disc is what hurts. The disc won't hurt you. And in fact, about 15% of people walking around with no back problems have a disc problem in their back, but they're not feeling it. The reason is the disc itself doesn't hurt, it only hurts if it's rubbing a nerve, which it comes very close to. So we treat a lot of disc problems here. Probably one of the most common things we see, that disc can rub against a nerve and cause all kinds of problems. Wherever that nerve is going, you could be suffering pain from, down the leg like sciatica, or into the arm if it's in your neck, or even around the chest if it's in the middle back. So that just causes a lot of problems. There's a lot of treatments available. One of the best things we've found over the years is spinal decompression. So we're sitting in our decompression room. We have 2 of these Triton DTS tables. And what they do is through a pulley system, they gently traction or open up the spine. And this fancy computer goes through all different patterns of different pulls in order to take pressure off that disc. So what will happen over time, that disc gets sucked in a little bit and it can get pressure off the nerve. It's really highly successful, one of the most successful things, and there's really no side effects. Gentle stretching feels good. Patients fall asleep in here every day, and it's a really gentle, effective treatment for it. So you may not have heard about, the tables aren't everywhere. They're a little bit expensive, so you may not have heard of this treatment. It's a lot safer than injections, drugs, and surgery. It's a great way to get rid of disc pain naturally. So if you're interested, give us a call, 908-813-8200.